With epiglottitis, itis means inflammation, and epiglottis is a flap of elastic cartilage that sits at the top of the larynx or voice box. The epiglottis keeps food and liquid going down the esophagus and prevents it from going down the trachea by accident. So bacterial epiglottitis is when bacteria infect this flap of tissue and cause it to get swollen. This can be life-threatening because it can flop down and block the trachea, making it impossible to breathe. This infection is actually thought to have been the cause of death for George Washington, America's first president. Now, the larynx is located in the bottom portion of the neck, just below where the pharynx splits into the trachea and the esophagus. The larynx is also called the voice box because it contains the vocal cords, which are two folds of mucous membrane that can open and close like curtains. Just like the rest of the respiratory tract, the walls of the larynx are made of mucosal epithelium. The epiglottis extends from the base of the tongue and anchors to the anterior rim of the thyroid cartilage, which is just in front of the larynx. The lateral borders of the epiglottis connect to the ariepiglottic folds, which have ligamentous and muscular fibers. This allows the epiglottis to act like a lid on a box and serve as the guardian of the airways. During swallowing, the epiglottis covers the larynx, preventing food and liquids from entering the airway. And during breathing, the epiglottis opens the larynx, allowing air to flow in and out. Epiglottitis happens when the epiglottis, ariepiglottic folds, and other adjacent tissues become infected. Most commonly, epiglottitis is caused by Haemophilus influenzae, a gram-negative rod bacterium. But in settings where Haemophilus influenzae type B vaccine is used commonly, other bacteria like Group A Streptococcus can also cause the infection. These bacteria are spread person to person by direct contact, or through respiratory droplets that are created when people cough or sneeze. Once the bacteria enter the body, they can get through the epithelial layer of the epiglottis. Immune cells in the epiglottic tissue detect the invading bacteria and release cytokines, like tumor necrosis factor alpha, or TNF-alpha. The cytokines cause blood vessels to become more permeable to fluid, which results in local inflammation or swelling. As the inflammation gets worse, the swollen epiglottis starts to fatten up and block the larynx, which obstructs airflow. And if the infection is severe, it can quickly lead to respiratory failure. In severe cases, respiratory failure can lead to a respiratory acidosis, which is a buildup of carbon dioxide in the blood. Symptoms of epiglottitis can worsen quickly. As the infection becomes severe, it can lead to fevers, and it can cause trouble breathing, and some describe it like a person talking with a hot potato in their mouth. There can be signs of airway obstruction like a high-pitched noise on inspiration, called stridor, retractions, which is where the ribs show through as they breathe, and a person often tripods, which means that they lean forward, leaning on their arms to keep their airway open. Diagnosis of epiglottitis in a person who's stable and breathing comfortably is done with an X-ray, which will show an epiglottis and ariepiglottic folds that look a lot fatter than normal, like a thumbprint. A CT scan would also show a narrow airway from tissue swelling, but lying flat for a CT can be dangerous because it can make the epiglottis further obstruct the airway. Finally, an endoscope, which is a long tube with a camera at the end, can be used to look directly at the epiglottis, which typically appears swollen and cherry red in color from the inflammation. Treatment for epiglottitis, first and foremost, is always about airway management. Individuals are often given extra oxygen, and in severe cases, they might need tracheal intubation, which is when a tube is sent through the vocal cords to keep the airway from closing shut. In some rare cases, if tracheal intubation isn't possible, a needle or surgical cricothyrotomy might be needed, both of which are techniques to open up the cricothyroid membrane, creating a passageway for air to go into the trachea below the level of the larynx. Once the airway is stable, antibiotics can be used to treat the infection, and intravenous steroids can be used to decrease the swelling from the immune response. Finally, immunization against Haemophilus influenzae type B can be used to prevent that bacteria from causing epiglottitis in the first place. And this is an intervention that has nearly wiped out the disease in vaccinated children. Alright, as a quick recap, Bacterial epiglottitis is a vaccine-preventable disease that's most often caused by Haemophilus influenzae. Symptoms include a hot potato voice, stridor, retractions, and tripoding. And classically on an X-ray, the epiglottis can look like a thumbprint. The infected epiglottis can cause severe airway obstruction, and in really severe cases can require tracheal intubation, or even a cricothyrotomy. With laryngitis, laryng refers to the larynx, and itis refers to inflammation. So laryngitis is inflammation of the larynx, something that especially affects children. It's further classified into acute if it lasts less than 3 weeks, and chronic if it lasts more than 3 weeks. The larynx is located in the upper portion of the neck, just below where the pharynx splits into the trachea and the esophagus. The larynx is also called the voice box because it contains the vocal cords, which are 2 folds of mucous membrane that can open and close like curtains. When they're closed, air pressure builds up below them, causing them to vibrate and produce sound when we speak. Like the rest of the respiratory tract, the walls of the larynx are made up of mucosal epithelium. The mucosal epithelium contains goblet cells, which produce mucus to trap small foreign particles, as well as columnar cells, which have cilia, which are tiny little hair-like projections that move the mucus up the respiratory tract so that it can be coughed out. Acute laryngitis is most common, and it's usually due to an upper respiratory tract infection, most often due to a virus. These viruses are the same ones that cause a common cold, like rhinovirus, coronavirus, influenza virus, respiratory syncytial virus, or RSV for short, and parainfluenza virus. Bacterial infections are another cause of acute laryngitis, and sometimes they can develop during or right after a viral infection, and that's called a superinfection. Common bacterial causes include group A streptococcus, Streptococcus pneumoniae, or Haemophilus influenzae. These bacteria, and particularly Haemophilus influenzae, have a special preference for the superior portion of the larynx and the epiglottis, causing epiglottitis. In acute laryngitis, the goblet cells oversecrete mucus, and this leads to the congestion of the airway. And immune cells like neutrophils and macrophages release chemicals that cause pain and swelling. Swelling of the vocal cords changes the way they move. Imagine 2 thin sheets flapping in the wind, turning into 2 large pillows that barely move. As a result, the vocal cords don't move and vibrate smoothly, which causes dysphonia, or hoarse voice. Chronic laryngitis is less common, and is associated with allergies, or the result of chronic exposure to irritating agents, like cigarette smoke. Reflux laryngitis is another cause of chronic laryngitis, and develops in people with severe gastroesophageal reflux disease, where acid from the stomach goes all the way up the esophagus into the pharynx. From there, the acid can contact and irritate the larynx. Finally, there's overuse of the voice, like yelling or a really prolonged karaoke session involving the Beatles. That could lead to both acute and chronic laryngitis. In chronic laryngitis, the normal columnar cells undergo dysplasia, which is when they transform into squamous epithelium to adapt to the chronic irritation. This dysplasia increases the chance that these cells might eventually develop into laryngeal cancer. The main symptoms of laryngitis include hoarse voice or dysphonia, as well as cough, and in severe cases it can lead to difficulty swallowing or dysphagia, because the swollen larynx might compress the esophagus. Some children have shortness of breath or dyspnea, since they have smaller airways. So laryngitis comes down to the 3 Ds: dysphonia, dysphagia, and dyspnea. Diagnosis of acute laryngitis is mainly based on the symptoms. For chronic laryngitis, though, laryngoscopy can be helpful. That's when a long tube containing a camera is inserted into the mouth to directly see the larynx, and to take a biopsy of the tissue if needed. The main purpose of this is to ensure that there's no sign of a laryngeal cancer. Generally speaking, for acute laryngitis, the treatment is resting the vocal cords, as well as getting fluids and pain medications. For bacterial infections, antibiotics can be helpful. For chronic laryngitis, it's important to treat the underlying issue. For example, using allergy medication, avoiding irritating agents, and using gastroesophageal reflux medications. Alright, as a quick recap. Laryngitis is inflammation of the vocal cords, and it causes dysphonia, dysphagia, and dyspnea. Acute laryngitis usually lasts for less than 3 weeks, and usually resolves on its own, although antibiotics are helpful for bacterial laryngitis. Chronic laryngitis lasts for more than 3 weeks, and is usually caused by allergies or exposure to irritating agents, or gastroesophageal reflux.
Hi everyone, I'm Sam. I'm a new member of the Osmosis Animator team. So, laryngitis. I've had it before, you've probably had it before, and no wonder. You can get it so many ways, it's crazy. In any case, I hope this video was informative and useful for you. This was the first YouTube video I've worked on, and I had a great time doing the illustrations. But of course, as with all things Osmosis, it was a team effort, so shout out to the other contributors. Antonella wrote the script, Rishi and Yifan did the script editing, Tanner did the voiceover, and Sam G edited the video. As always, if you appreciate our videos, please like, follow, and share us on social media. If you'd like access to more learning resources on laryngitis or other video topics, you're going to want to make your way over to osmosis.org. There you can find flashcards, quizzes, and other great study tools. That's it for me, guys. I'll see you next time.
Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today. With laryngomalacia, laryngo refers to the larynx, and malacia refers to a body tissue that's soft. So laryngomalacia is a developmental condition where the larynx doesn't form right and ends up being soft and floppy. Now, normally the epiglottis, which is a flap of cartilage just above the vocal cords, makes a firm arc over the airway. This guy's connected to the larynx by cartilaginous structures called ariepiglottic folds. In children born with laryngomalacia, the ariepiglottic folds are shorter than normal, so they end up pulling the normally arc-shaped epiglottis down into a distinctive omega shape. Weak laryngeal muscle tone is thought to cause the condition, but the exact mechanism isn't well understood. The cartilaginous tissues are also softer than normal, so they flop into the airway. This means that when the child breathes, that floppy structure gets sucked into the airway. And this causes stridor, which is a high-pitched whistling sound during breathing. In some cases, the obstruction of the airway can be so bad that it makes breathing difficult. These symptoms are usually present in infants a few weeks after birth, peaking at around 6 months. Laryngomalacia, though, typically self-corrects around 12 to 18 months, as those throat muscles strengthen over time. If laryngomalacia is suspected based on the symptoms, the diagnosis can be made by laryngoscopy or bronchoscopy, which is using a camera to look down the throat for the classic omega-shaped epiglottis. Treatment is rarely necessary, but if the problem persists, then it can be resolved surgically. The shortened ariepiglottic folds can be cut, which releases the constrained omega-shaped epiglottis, restoring it to its proper shape and helping to open up the airway. Alright, as a quick recap. Laryngomalacia is a respiratory condition where the cartilaginous tissues of the larynx don't develop correctly, which leaves it soft and floppy. Shortened ariepiglottic folds pull the softened epiglottis into an omega shape, which obstructs the airflow and causes stridor. Laryngomalacia generally resolves over time, but if it persists, it can be corrected surgically. What's up, guys? Thanks for watching. That was a short and sweet video on laryngomalacia. It was written by Fergus, who is our newest scriptwriter, and he is kicking out a bunch of really awesome scripts. So definitely be on the lookout for more videos in the future coming from him. Rishi did the editing of the script, and I did the visuals as well as the voiceover. And then, even to add to that list, we have Sam, which is our newest video editor, who did the editing on the video as well. So welcome, Sam and Fergus. If you guys want to do a deeper dive on this topic, you should definitely head over to osmosis.org, where we have a bunch of quiz questions and flashcards and other sweet resources for you to take advantage of and learn more stuff. So if you're interested, go over there, make an account. Otherwise, you can always support us by donating on Patreon, subscribing to our channel, and following us on social media. All right, guys, I'm out. See you later.